Is your doctor's office checking your blood pressure correctly? There's a good chance that they are not. I have trained hundreds of healthcare workers to take blood pressure the correct way. But when I go to the doctor, my blood pressure is rarely taken the right way by following the American Heart Association guidelines. My guess is that your blood pressure is not being taken correctly either. And because you don't have the good fortune of having my education and experience, you don't even know it. If the person taking your blood pressure is not doing it right, you can end up with an incorrect reading. And that incorrect reading can affect your health more than you think. Hi, I'm Valerie, a lifestyle nurse, and I'm here to help you optimize your health and longevity. In this video, I want to empower you to take control of your health. Your blood pressure measurement is one of the most important parts of your doctor's visit. An accurate blood pressure reading is so very important because it can reveal hidden risks for many dangerous conditions like heart disease, kidney failure, and stroke. An incorrect reading could lead to not getting the treatment you need or being prescribed medications that you don't need. And it's nothing to get angry about. This is not the point of this video. The healthcare worker taking your blood pressure is probably overworked, rushed, or even just plain burned out. And unfortunately, cutting corners is a part of the culture of healthcare, just like it is with a lot of jobs, where we are expected to do too much in too little time. The point of this video is so you can watch out for yourself, or even a loved one, by being educated. In this video, I'll show you how to make sure your doctor's office is doing it right, and what you should be looking out for. I'm also putting together a little checklist that you can print off and bring along with you to your next doctor visit. So look for a link to that in the video description. Let's start with the basics. What exactly is blood pressure? In simple terms, it's the force of your blood pushing against the walls of your arteries. We measure two things: systolic pressure, the top number, which is the pressure when your heart beats, and diastolic pressure, the bottom number, which is the pressure when your heart rests in between beats. Why is blood pressure so important? High blood pressure is often called the silent killer because it can creep up on you without any symptoms at all. And nearly half of adults in the United States have it. If left uncontrolled, high blood pressure can lead to heart attacks, strokes, kidney failure, vision loss, and more. That is why it is so important for these numbers to be accurate. A small error in measurement could mean the difference between being correctly diagnosed with high blood pressure or thinking that you're in the clear when in actuality you are not. An incorrect blood pressure reading is a big deal. When your blood pressure is measured incorrectly, you might get numbers that are either too high or too low. Either way, this can be dangerous. For example, if your blood pressure reading is higher than it actually is, you could be prescribed medications that you don't need. This can lead to side effects, including your blood pressure being too low. This can cause a whole lot of issues and unnecessary medical expenses. On the other side, if the reading is too low, your doctor might not catch if your blood pressure is actually high, meaning this important risk factor will go undetected. One of the most common mistakes is arm positioning. A recent study showed that having your arm in your lap or hanging by your side or unsupported in the air can increase your systolic reading by up to 6 points. I know it doesn't sound like much, but when you're on the borderline of needing or not needing medication, or even just needing continued monitoring, those few points do matter. So what's the right way to take blood pressure? Here are the key steps that your healthcare provider should be following. You should sit quietly for at least 5 minutes before the reading is taken. No talking, no movement. If you're chatting with your doctor or moving around, or if they take your blood pressure right after you walk into the exam room, that can elevate your blood pressure. You should also avoid caffeine, exercise, and smoking for at least 30 minutes before your measurement. You should also not have a full bladder during the reading. You should be sitting comfortably with your feet flat on the ground, legs uncrossed, back supported, and your arm resting at heart level on a desk or table. If your arm is hanging by your side or you're holding it up yourself, your reading will be inaccurate. The cuff should fit snugly around your upper arm, and it needs to be the right size. If the cuff is too small, it'll squeeze too tightly and give you a falsely high reading. If it's too large, you'll get a reading that's too low. You should not hear Velcro popping and breaking when that cuff is being inflated. A lot of times, if you are bigger, they don't want to embarrass you by saying they have to go get a bigger cuff. But trust me, it is in your best interest that they do. You might even want to mention it. Some more experienced workers or those that are familiar with you may have already discreetly figured this out before they bring you to the room. Blood pressure should always be taken on a bare arm. Tight sleeves should not be rolled up to the shoulder, as that can create a tourniquet effect and can alter the reading. The provider taking your blood pressure should feel for your pulse around the crook of your elbow so they know how to correctly position the cuff and where to place the stethoscope if they are not using an automatic machine. You could feel that for yourself now so you know what I'm talking about. There it is. Neither you nor the person taking your blood pressure should talk during the measurement. If this is your first visit, they should be taking your blood pressure on both arms. And a blood pressure that is elevated should always be repeated. If it remains elevated and this is new for you, you should be asked to come back in 1 month for a recheck. Any person taking your blood pressure can provide you with your results, so just the numbers. But only a licensed clinical provider like a doctor, a nurse practitioner, or a physician assistant can tell you what the numbers mean, even if it's high or low. So now this is where you come in. You are your own best advocate. Don't hesitate to ask questions or raise concerns if something seems off. Here's what you should look out for during your next visit. Is your arm properly supported at heart level? Did the healthcare worker use the correct size cuff for your arm? Was your blood pressure taken on a bare arm without a sleeve tightly rolled up? Have you been sitting still and quiet for at least 5 minutes before the measurement? Are your feet flat on the floor, and is your arm supported at heart level during the measurement? This might seem like small details, but they can make all the difference in getting an accurate reading. Also, if they only take one reading, it's okay to ask for a second one, maybe even one towards the end of your visit, especially if it is elevated or differs from your usual reading. Blood pressure can fluctuate throughout the day, so multiple readings help to ensure accuracy. So let's recap. An accurate blood pressure reading is more than just a routine part of your checkup. It is a critical part of safeguarding your health. With so many factors that can throw off your numbers, like incorrect arm positioning or using the wrong cuff size, it's important to know what's right and to feel empowered to speak up. Remember that you are your own best advocate. Don't hesitate to ask your doctor or nurse to double check the setup if something feels off. After all, it is your health that is on the line. So whether you're managing high blood pressure or you're just there monitoring it as part of your wellness checkup, these numbers matter more than you think. So here's what I encourage you to do. Next time you have your blood pressure taken, speak up. Ask about if you should rest first, or about your positioning, or about if your sleeve should be removed. Ask about the cuff size. Don't be afraid to be an active participant in your healthcare. Look below in the video description for a link to a blood pressure checklist that you can download for just $2 and print it and bring it to your next doctor visit. Maybe print 2 and provide a copy to your doctor. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to my channel for more practical health tips to help you optimize your well-being and longevity. Share this video with someone who might need to know about the importance of accurate blood pressure readings, because we all deserve the best possible medical care according to the most recent evidence-based guidelines. Stay informed, stay empowered, and stay healthy. And I'll see you in the next video. Until then, take good care of yourself. Thank you for watching.